Hi everyone, welcome back to Staying Compliant with KW Advanced Consulting. My name is Keisha Wilson. I am the founder of KW Advanced Consulting. Thank you all for joining us today, for subscribing, for sharing, for liking. We truly appreciate all the support. Today, I want to talk to you about telehealth. Telehealth, it is not going away. I know you guys have heard me speak about telehealth on various episodes, or maybe you've head on over to KW Advanced Consultant and read one of our coding articles on telehealth. If you haven't, you definitely want to check it out. I am going to share that with you as well. Or maybe you heard me speak about it at AAPC HealthCon. I've spoken about it maybe 6 different times already, and it's an important topic. It's not going away. Sanal Patel and I had this amazing workshop last year, and we're looking to do it again. And we dove into telehealth and what it looks like. We had an amazing Dr. Michelle Griffith, who's an internal medicine provider, but she's also the president of the International Society in Telehealth and eHealth. And I get to work alongside of her as the chair of the HDDH working group, where my group focuses on disparities when it comes to telehealth internationally in various countries. So we have a group of physicians and different people in digital health space all working together. One doctor is working heavily in Africa, trying to bring telehealth and just awareness and healthcare to his patients virtually and in person as well. We have another two founders that had opened up a business in Barbados and was providing hematology oncology service to their patients there and others. But that being said, telehealth has been here a long time. You've heard me give the timeline of it before. It's that started out in the early 1900s with NASA using it, and then physician to physicians used it, and then they started using it when it came to patients. If anyone worked in the telehealth space before, you know that prior, a lot of organizations had to get grants because it was not covered by Medicare and a lot of payers. And then also, if you were in the federally qualified healthcare centers and RHCs, the rural area, it was really restricted when it came to just originating site. They weren't able to provide distant site services. Then in came the public health emergency. So now where we're in February 2026. We've had a few extensions since the public health emergency had ended on May 11, 2023. We know in September, the end of September 2025, we had a government shutdown, which affected us for quite a long time when it came to telehealth. A lot of organizations didn't know what to do. CMS did put out an MLN, and they did give guidance and instructions to the MACs that providers should initially they were holding the claims for 10 days, but the shutdown happened longer than we expected. Then they also mentioned the advanced beneficiary notice, the ABNs. A lot of people forget about ABNs, but they're still relevant till today. So that ABNs are the form that you have your patient sign way in advance to say this is a service. They understand that this is a service Medicare may not cover. There's 3 different options. There's also modifiers that would apply. You're going to append which one's applicable to the service that you're having. You want to make sure it's filled out in its entirety. It is signed, it is dated. Currently, the one that's on CMS website expired January 31st, 2026, but until they have a new one, they have instructed providers and organizations to continue to utilize that one until the new one comes in place. Once there's a new ABN, it's good for 3 years. So some organizations had their patients sign ABN. Then the government, thank goodness, they opened back up and they had some extension when it came to telehealth until January 30th, 2026. So we were coming down to the wire when it came to January 30th, 2026. And then they were talking about another shutdown, right? They did not extend it right away. So we had a lapse of a few days. Then on February 3rd, 2026, they passed the Consolidation Appropriation Act of 2026. So if you have listened to me before, you know there's quite a few Consolidation Appropriation Acts. And this is, they updated 2021, 2023, and this gives extension to a lot of the flexibilities when it came to telehealth services that took place during the public health emergency. So right now with the Consolidation Appropriation Act of 2026, a lot of the flexibilities that were set to expire has been extended until December 31st of 2027, which is awesome. About a 2-year almost extension we kind of give. So we don't have to stress about it too much in 2026, in 2027 either, only when it's coming down to the end. So one, we're talking about the sites. Medicare patients can continue to have telehealth visits from the comfort of their home. And we know I have used and talked about my mom before when it came to this service because she's a patient who is post cancer and chemotherapy and keeping them safe. We utilize telehealth services for her visit. I talked about it in September when we had that whole expiration and how it affected millions of Medicare patients. And she was one, right? Her doctor's office had to cancel her telehealth visit and was informing her that she would need to come back in for her appointment. So thank goodness they can continue to provide and have services from the comfort of their home. That also being said, is it important that physicians document where is the patient located so that decoders can append the appropriate place of service. So we have place of service 2 for if the patient's not in their home. We have place of service 10 for if the patient is in their home. But then we also have individual payers as well as Medicaid providers in different states who want different modifiers. Place of service. They still want place of service 11, maybe 19, 22. It depends. So you want to look at your payer policies. You want to look on their websites and see. For example, I reached out to New York State Medicaid about this, and they had mentioned about payment parity in their updated guidance and to be considered or be billed under payment parity, which means that they're going to cover the virtual visits as they would in-person visits. You want to append the appropriate place of service. So they still wanted place of service 11, for example, for office visit. So it's not one size shoe fits all, and unfortunately there is no shortcut. You do have to research and double check. I know everyone always wants like an easy fix, and it's not an easy fix when it comes to telehealth. You have to research, you have to look at your payers, you have to see what each individual one wants, and you can create an Excel sheet. Should your organization need help with that, that is something you can reach out to KW Advanced Consultant to do. This is something that I do in my sleep. I help organizations when it comes to telehealth in creating a structure because it's not going away. We are in this space. It is here to stay. It's not going away. So remember that. We just have to know how to do it and conduct our telehealth practices compliantly. So it's important you document where the patient is located, mentioning that you have just checked the geographic restrictions or area. That is not enough. We need to know, are they home? Are they in a hotel? Are they in their car? Where are they located? Consent, you still want to obtain consent for these visits as well. Audio only has been extended for non-behavioral health until December 31st, 2027 as well. So that's great. You also want to document. So, as providers, we have to have two-way audio video for our patients. If your patient doesn't have that capability or they don't want to use it and they just want to use audio only, that should also be documented in the record. All right, so that's amazing. Physical therapists, speech language pathologists, audiologists, and OT can continue to provide services to the Medicare patients until December 31st of 2027 as well. We also have behavioral health. That 6-month requirement of when they would have had to come in person has been extended until December 31st of 2027 as well. But also remember that telehealth health has been made permanent for behavioral health services. So this was something made permanent a while ago. And you want to double check and research your Medicare rules and regulations when it comes to telehealth. There's quite a few things that has been made permanent and others where we still have to rely on the federal government to make permanent or extend flexibilities. Also, one good win too for the acute hospitals when patients were being treated at home, that has been extended until September of 2030. So giving a 5-year span for that. And that's amazing. They're doing research. Some research is due by 2029 for that information, for them to, come to a final decision. So there's a lot of flexibilities. There's a lot of extensions that happen. You want to make sure that you are staying compliant, that you're getting audit ready. The OIG had did an audit in 2021 when it came to telehealth. You want to look back at that audit, look to see what they're doing. You want to check your systems. You want to make sure that consents are being obtained, insurances is being updated, that your templates are also updated to make sure you're capturing the documentation that's required for telehealth. That is another service that KW Advanced Consultant that we do. We help organization in updating their templates to make sure that it's also compliant. And being on various committees, I was on the EPIC committee, NextGen committee, CERNA committee, a lot of committees, understand the templates, and being that my middle name is compliance, to make sure that it's updated. So this was a snipping of what we have going on in telehealth, so it's not going away. You also want to double check your codes. You want to make sure that you know which payers are taking the 98000 codes. Not all payers are paying it. Some are saying, like Medicare and Medicaid, they also mentioned that they are not accepting those codes, and you should build appropriate office visit with the appropriate place of service and modifiers. Stay tuned, modifiers, another one we're going to talk about next time. So this video is just to tell you we are here to stay. It's not going away. So you want to make sure that you are keeping abreast of everything that is current. You want to continue to look at your payer policies. You want to look on the websites. You want to create some policies and procedures. Again, another thing, service that KW Advanced Consultant provides, policy writing. You want to start implementing and creating policies around telehealth if your organization doesn't have that. So if you need to contact us for a consultation, you can reach out to kwadvancedconsultant.com and go to our contact us page, and we would love to put a proposal together for you to help your organization. So stay tuned. If you have not visited the website, I just want to share that with you as well. You can head on over to KW Advanced Consultants website. We have various articles that are posted on telehealth. This was the most recent one that was updated after the Consolidation Appropriation Act was passed. And everything that I mentioned to you today is also listed on this website. So a lot of helpful information. You can read through it and you can pin it, and also you have the resources available to you. So I hope this was helpful. Again, thank you for hanging out with us for a few minutes. I hope you have an amazing day. Don't forget to subscribe, like, and share, and I will see you all soon. Bye-bye.